Sabbir. I just wanted to check and ask. I have a pain in my shoulder, so I was just wondering what that pain could be.
Pain in the shoulder can arise from many different instances. It could be from a neck pain. It can originate from the neck. It could also originate from the shoulder. If, let's say, you had a recent injury, a trauma to the shoulder, fall on your outstretched hand, or even a direct trauma to your shoulder, you could have something called a rotator cuff injury. So you could have tears of your rotator cuff tendon. The shoulder pain could also arise from the bony structures around it. It could be from a fracture of your clavicle. It could be a disruption of your AC joint. Basically, without a clinical examination and without the proper investigations, we are unable to actually deduce. After all the clinical examination, only then can we target the actual injury that you may have had.
Hi doctor, I have trouble reaching up and behind without it hurting my shoulder. What do you think the problem could be?
Most of the time, if you are unable to reach overhead, and especially for women, if they're unable to undo the clasps of the bra and the clothes, and it causes severe excruciating pain, majority of the time it could be a rotator cuff injury. A rotator cuff injury means, what is a rotator cuff? Rotator cuff is actually a group of 4 muscles with tendons which are actually responsible for the movement of our shoulder. It allows for elevation and as well as rotation of the affected shoulder.
Hi doc, when do I actually need to see a doctor regarding my shoulder pain, and what are the signs?
Okay, you would need to see a doctor for your shoulder pain if the pain is severe, excruciating, or after a recent trauma, right? So if you had a recent trauma which is pretty significant and causes you severe pain, swelling, limitation of movement of the shoulder joint, then it is you have to see a doctor then.
Hi doctor, should I be worried about long-term effects and the lifelong consequences?
If you get early treatment for your injury, then majority of the time you do not have to suffer the long-term consequences.
Hi doctor, are there any treatment for shoulder pain?
There's a lot of treatments for shoulder pain, but it all depends on what the shoulder pain is due to. Okay, let's say if it's a fracture of your clavicle, or let's say if it is a disruption of your acromioclavicular joint, then we have to do a surgical. We can do conservative bracing, or we can do surgical, which is a fracture fixation of the clavicle or AC joint reconstruction. After 6 weeks, you should be good as you were, back to normal. Let's say the trauma was due to an injury on the rotator cuff tendon, the supraspinatus tendon or the infraspinatus tendon, or a mixture of both tendons or all 4 tendons, which could have been a very bad trauma, then we will need to do something a bit more aggressive. But always the best is to treat it early. The longer you keep it, the harder it becomes to treat it and worse the prognosis. So what do we do for rotator cuff surgery, rotator cuff tears? If you are going through the surgical route, we do arthroscopic rotator cuff repair.
What happens when surgery is required? What are the options?
If surgery is required for rotator cuff, that means we will proceed to doing something called arthroscopic rotator cuff surgery. Arthroscopic rotator cuff surgery means we make a few holes or a few apertures in the shoulder. One is to introduce the camera for us to be able to visualize the whole shoulder joint, and the other few holes are to repair the torn tendons. Usually, how do we repair it? We will usually use anchor sutures, okay, which will anchor onto the bone, and the sutures will repair or stitch back the torn tendons.
Doctor, what is the recovery period after the surgery?
The recovery period after the surgery will take between 6 weeks to 3 months. The physiotherapy after the surgery is very important for a successful recovery and for a successful operation. What do we mean by physiotherapy? When we do physiotherapy, basically is to regain back the range of movement, to regain back the strength, as well as to achieve being able to do the normal movements of the shoulder that you were prior or before the accident or the trauma took place.